project is over biomechanical analysis of ergonomics.
So starting off, I'm going to talk about proper standing, but most of these do apply to all three of them. The screen should always be at eye level, elbows should always be no less than 90 degrees, and your shoulders should never be flexed. The head should definitely be straight in line with your spine. The screen should be at 20 to 28 inches away from your eyes. And then for standing, your hips should be upright to keep the S curve, and the proper shoes are best for the support. So for proper sitting in a chair, the only things that are really different is your hips should be pushed as far back into the chair as possible. The knees are at a 90-degree angle, and they stay in line with the hips, and then your feet should be firmly on the ground. For proper sitting on the exercise ball, the only difference really here is that the ball needs to be the appropriate type and size, and there are different sizes for how tall you are, and that the feet, if you widen your feet, it'll increase your stability, and if you move your feet closer, it challenges your balance and your core muscles. And a little tip that the exercises balls don't meet the HSE regulations, which is the 5-star base, including height adjustment and adjustable back. So if your company provides you that and you fall, they could actually be liable.
All right, so for the anatomical analysis, we decided to compare and contrast the sitting in a chair versus sitting on an exercise ball. The similarities, your rhomboids, they're going to be isometrically contracted on both. This is just going to retract your scapula. The sternocleidomastoid and upper trap, they're both going to be isometrically contracted as well to stabilize the head. And then the cervical erector spinae are going to be isometrically contracted as well for neck and head stabilization. All right, and there is some differences between sitting in a chair and the exercise ball. In the chair, your erector spinae muscles, they're going to be activated, and this is to keep the spine in an upright position. However, when you're sitting on the exercise ball, there's going to be higher muscle activation just because you're going to be on that unstable surface. Both of them the rectus abdominis and the obliques are both going to be working to balance the pull from the erector spinae, which is also going to help keep the spine upright and good posture. However, when you're on the exercise ball, this is going to work more just because the erector spinae muscles are working more as well. The quadratus lumborum is going to be active in both of them as well. This is going to help stabilize the pelvis and keep the lower spine upright while you're in a chair. And then its activation is going to be higher when you're on the exercise ball. This is due to no back support, and it's also going to be active so the ball does not slide out from underneath you. And then on the exercise ball, you're also going to have multifidus and the transverse abdominis activated. The deeper core muscles there keep your center of gravity in place and maintains your balance. All right, so on this graph, you can see what I had just been talking about the erector spinae working more when you're on the ball than when you are in the chair. You can see that is the main significant difference is coming from your erector spinae, from the thoracic and from the lumbar area. Your rectus abdominis and your external obliques are actually going to be fairly similar whether you're on the ball or in a chair. The anatomical analysis for standing at a desk, everything's just basically going to be isometrically contracted. You're going to have your sternocleidomastoid and upper trap for your head and neck stabilization. Your rhomboids and serratus anterior are going to be for your shoulders, and then your trunk's going to be isometrically contracted with your rectus abdominis and obliques, and then your lower body is just going to be your isometric glutes, quads, hamstrings, and your gastroc.
Ergonomics is the study of people's efficiency in their working environment. What we want to look at is the underlying biomechanical objectives that help do their part in achieving this goal for maximum efficiency. So we will be evaluating on a biomechanical level the comparisons between sitting and standing, and ultimately give our suggestions for working at your desk space effectively without causing injury, pain, or dysfunctions later on in your life. With this, there are forces that are acting on the body. The three main forces that will be addressed are the body weight, the ground reaction force, and torque. When one is sitting in a chair, it'll be made known that the ground reaction force doesn't come up through the feet as if the person was to be standing, but rather through the ischial tuberosities and then up through the spine. And lastly, we'll address torque where it's relevant, such as when the body's exhibiting trunk flexion, when the person's sitting in improper posture, which is pretty frequent when sitting at a desk. The components that we're going to be comparing between and discussing in further detail will be torque, center of mass, forces, base of support, muscular activation, and pressure. The biomechanical analysis of sitting at the proper 90 degrees of flexion in a chair would adjust your center of mass to be closer to the ground, which ultimately leads to greater stability. So your center of mass line, as indicated in the picture to the left, will be anterior to the spine, and it's to be noted that your center of mass would move anteriorly if the person was to be exhibiting trunk flexion, say by leaning forward, which is a common habit for many people who are sitting at a desk. With the center of mass being anterior to the spine, we would consider that to be neutral position, so relatively normal, essentially meaning that there is just some torque being created, but nothing in an excess amount. When you lean, however, you are creating this larger radius from the center of mass, which ultimately does bring about a larger torque. So when sitting in this properly erect posture, the pelvis is tilted anteriorly, which is going to increase your lumbar curvature, reducing the moment arm of the body weight, which is ultimately reducing muscular support and the load on the lumbar spine. So if you are sitting, it is important to try and have the pelvis tilted anteriorly to try and achieve some lordosis of your lumbar spine. As you can see in the picture to the left, the difference between slouching in your chair in comparison to sitting in this erect way. Anna will mention how standing will allow for the natural curves, the inward lordosis and outward kyphosis, because when you do sit, these natural curvatures are often compromised. This means that the ground reaction force will act directly up on the body through the spine, ultimately being a larger force because this force isn't being properly dissipated by the curvatures in your spine. So with the lowered center of mass comes greater stability, and stability is coming from sitting on the chair as well, with isometrically activating your abdominal and erector spinae muscles. What I arguably consider to be the most important biomechanical factor in addressing posture while sitting is pressure. Pressure is equal to force divided by area, and as you can see in the image to the left, when the trunk goes into forward flexion, there is a bending moment in the intervertebral discs. On the posterior side, there are tensive forces, and on the anterior side, compressive. And these compressive forces occur only over a small area of the intervertebral disc, thus overall a smaller area. As previously mentioned, a larger force is acted on the spine due to its direct contact with the chair. And then additionally, when in spinal flexion, there's the larger radius, therefore larger torque and larger force campaigning for the flexion. So an increased force and a large force over a small area will create a larger and increased pressure from, quote, normal. This puts you at extremely high risk of damaging the discs, with even the potential of a herniated disc if done repeatedly and for a significant amount of time. And quite frankly, no one should be doing that kind of damage to their body when they're just sitting at their desk at their office.
We found that leaning back past 90 degrees actually decreases that pressure and strain on the lumbar spine even more. The most decrease is seen when leaning back somewhere between 100 and 130 degrees. However, this type of reclined position isn't always conducive to work environments and being productive. The picture at the bottom of this slide offers some other ways to increase or maintain the lumbar curve, such as using a support between your back and the chair or sitting on a prop to increase that angle between your thigh and back. So this picture shows that when you're sitting in your chair, as you move from trunk extension into trunk flexion, the pressure on those vertebral discs will increase.
As previously mentioned, we have a graph to demonstrate how an increase in the recline of a backrest as well as the addition of a chair's lumbar support is associated with a reduction in muscle activity when the back is resting on the backrest. Less muscle activity means less fatigue and tiredness for the back muscles, as well as less susceptibility for discomfort and injury. There is a serious reduction in muscle activity occurring from 90 degrees to 100 degrees, and then the biggest reductions in muscle activity are then found in chairs that have backrests that can recline between 100 and 130 degrees, or chairs that have suitable lumbar support. because the measured muscle activity levels are lowest here. I wouldn't necessarily suggest to lean back beyond 115 degrees at absolute most. However, mostly just because this might not necessarily be most conducive or appropriate for a work environment. And Caleb will touch on that in a little bit. When sitting on an exercise ball, you differ from sitting on a chair because there is significantly more activation at the trunk muscles. The erector spinae muscles will be working more, as Caleb previously showed in an earlier graph. The ball will require earlier onset of muscle activation, therefore the muscles will fatigue more quickly. On an exercise ball, there are no additions of backrests, which are crucial for achieving external support to maintain a biomechanically effective posture while sitting. As Anna showed, lumbar supports could even be added to chairs to encourage this lumbar curve for proper dissipation of forces. But without this support, it is easier to fall into bad postures and increase your risk of injury. It's also easier to create larger and unnecessary torque forces due to the increased ability for the center of mass to shift around with only a ball underneath the body.
Now we'll move on to the biomechanical analysis of standing. As you can see in the picture on the left, when you're standing with correct posture, your center of mass is slightly anterior to your spine and axis of rotation. Due to this distance, there will be a slight anterior external torque created from your body weight, counteracted by the posterior internal torque of your erector spinae muscles, which pull you back into correct posture. However, this amount of torque is normal. We found that when you're standing, you're more conscious of maintaining good posture, and this keeps your center of mass in its normal position as compared to when you're sitting and you're more inclined to lean forward. And so this helps limit any excess torque, and therefore there's less work of your muscles. The ground reaction force when standing comes up through your feet and is dissipated evenly throughout the spine due to the spinal curves remaining intact. Therefore, your spine experiences less force as compared to when you're sitting. Your base of support is provided between your feet on the ground. Lastly, a first-class lever is working to keep your body in correct posture. The bottom of your spine, meeting the sacrum, acts as the axis of rotation, and your erector spinae muscles in the back work as the force to counteract the anterior resistance from your center of mass. This makes sense as the mechanical advantage of a first-class lever is balance, and when maintaining good posture, you're essentially keeping your upper body balanced. So when you're standing, your lumbar curve remains intact, relieving some of that pressure acting on the spinal column. When sitting, a bending load is created, and this increases the pressure. However, when you're standing, the entire vertebral body evenly experiences those compressive forces, and this means a larger area, which therefore lowers the pressure. Additionally, the force is less because of the dissipation of those forces by the spinal curves, and this also decreases pressure. So we are referring to this normal pressure as 100% pressure, and a graph on the next slide will help us explain this more. This bar graph shows the pressure on the L3 disc in different posture positions. The third bar is highlighted, and it shows that 100% pressure when standing with correct posture. Moving over one, you can see that as soon as you lean forward and move that center of mass more anterior, the pressure on L3 increases to a 150% load. It is important to notice here that standing with incorrect posture actually puts more pressure on L3 than sitting with correct posture, which is a 140% load. So if you're going to stand at your desk, it is important to stand correctly, or else it would be more biomechanically efficient to sit.
So violations of these principles would be flexion of the hips, like leaning forward, a bad arch in your shoes, poor posture, poor body positioning, which would be deviating from the ideal position that you want to be in, and sitting in a reclined fashion but not giving yourself the other mechanisms such as the tilted screen or keeping everything else right. So for some prescriptions for improvement, when you're sitting, you need to transition slowly into standing at your desk. So the ultimate goal is to sit and stand equally throughout the day. If you are sitting, you need to get up and walk every 30 minutes to increase the circulation throughout your body and your legs. If you are standing, an anti-fatigue mat is recommended because it lowers the impulse, and impulse equals force times time. This lowers the ground reaction forces, and a smaller force creates a smaller impulse. When you're standing, proper shoes are also recommended because this cushions your foot to lower the ground reaction force, which then lowers the impulse also. The proper shoes would be to help the medial longitudinal arch to maintain and help those so the forces are dissipated throughout.
So ultimately, what should your posture be while at work? Standing is your best option. This has the least amount of pressure on your spine. The next best would be sitting in a reclined chair. This has actually got a little bit more difficult though at work because you'd have to adapt the rest of your surroundings to this reclined position as well. And then it'd be the sitting on a chair at a 90-degree angle, and then sitting on the exercise ball would be your fourth best option.